Hello, everyone. This is Dr. Shama Sultana, Hope in Hospital Chairwoman and founder of NARI'S Healthcare Organization. Today, here we are going to have a STI awareness by Pratisandhi. For this, we invite Dr. Seema Sharma ma'am and very cute Anisha Halan. So, as we go along, let's see first Ynhc and Pratisandhi's introductory videos, and let's introduce our speakers and let's start the session. So, Anisha, make me the co-host.
Okay, sure. I think it shows host on your name as of now.
Yes. So this is one introductory video about YNHC. In these 3 years, we had 500 plus medical camps and also workshops, awareness programs as well. So, so along with this, many times we have reached out a few other organizations for help and awareness program in association. Now we are with the Pratisandhi, and I want to play introductory video of our Pratisandhi. Can't be played.
Dr. Shama, I can probably also introduce ourselves like this.
Yeah.
Yeah, if that's
Again,
okay.
I will try one more time. Okay. About Pratisandhi, I love the theme. I love the work what youngsters are doing for young people and adolescents. So I request Anisha Halan to introduce about this program.
Sure, I'll just share my screen. I think you will have to give me the access to share. Okay, just give me a second. Okay, I hope my screen is clearly visible. Yeah?
Yes, it is.
Okay, great. So, hello everyone. I'm Anisha Halan, and I have with me Dr. Sima, and I want to introduce her because she's been a gynecologist for over 25 years, having written books and delivered many keynotes on sexual health. And I also want to mention that she is an advisor to Pratisandhi Foundation, and we are very grateful to have her here in this meeting. We are from Pratisandhi Foundation. I know that the video explained a lot, but it's a little bit of an old video, so I'll explain as to what we do as a whole. Pratisandhi Foundation has been working for about 6.5 to 7 years now, dealing with various age groups, various communities, various NGOs, organizations, and have been talking about and being or spreading awareness about all key thematic areas that come under comprehensive sexuality education. As for myself, I am Anisha Halan, and currently I'm leading the Department of Peer Education and Awareness at Pratisandhi Foundation. A little bit about what my department does is that we usually conduct sessions like the one which we are doing right now. And today's session is going to be about sexually transmitted infections. Without further ado, I'd like to start. Second. Right. So I know that this is mostly going to be a YouTube recording, but even then, do not try to trick us and try to react or answer the question that is being presented on the screen. The first question to you is, tell us whether this is a myth or a fact. STIs can only be transmitted through intercourse. I'll give you 3 seconds to answer the question. Anyone from the audience over here? If you could unmute or maybe drop in a chat, a text as to what do you think? Whether this is a myth or a fact that STIs can only be transmitted through intercourse. Any guesses? Okay, I see the chat. Okay, Aman over here says that it's a myth, and that's absolutely correct. STIs can not only be transmitted through intercourse, but it can also be transmitted through several other ways, and that is something that we'll discuss in the session when we move forward. Okay, the next question is that only people with multiple sexual partners can get an STI. Is that a myth or a fact? The answer, that's a myth. Absolutely. Not only people with multiple sexual partners get STIs, but people other than that can also get STIs. Again, something which we'll discuss further in the session. All contraceptives protect against STIs. Is that a myth or a fact? Okay, so that is actually a myth. Not all contraceptives protect against STIs. Only condoms are the contraceptive that reduce the risk of STI transmission during sexual activity. Condoms, okay, so this is one of the last questions. Condoms offer 100% protection against STIs. Is that a myth or a fact? And it's possible that you might get confused because of the last slide, but I'll still like you to try and answer the question. Do condoms offer 100% protection against STIs? So that's actually a myth. Condoms do not offer 100 protection against STIs, but they do reduce, the chances of the probability of someone of STI being transmitted. Okay. Once treated, an STI is gone forever. Is that a myth or a fact? Any other answers from the room, from the meeting? Okay, so that's actually a myth. Once treated, or even after the treatment has been done or completed, there still exists a chance of an STI to come back. So it's not always necessary that once the treatment has been done for an STI and that infection has been removed from the body, it's also possible that after some time that STI comes back into your body. So it's not always gone forever. Okay. The agenda for today is going to look like what are STIs. So I'm going to define what STIs are. I'm going to explain the symptoms of STIs. We'll discuss how to get tested, what are the ways of getting tested. We'll discuss some prevention techniques or methods for prevention of STIs, some common STDs and discussion about them in detail, and the stigma and support that we can probably eradicate and then move on to being an inclusive society as a whole. A few ground rules before we start the session look like active participation from everyone who joined the meeting, balanced contribution, consider peers as equals, judgment-free zone, keep an open mind. There's a possibility that you might feel as to why we are discussing this topic as a whole, but try to keep an open mind and keep this zone a judgment-free one. Confidentiality. So if you were to raise a question, ensure that you're not taking any names. Keep mic muted when no discussion is on so that the flow of the meeting does not get disrupted. Okay, so my first question to the audience is, what are sexually transmitted infections? What do you understand by the term? I'm going to wait for a few responses from the meeting. Infections transmitted via sex, okay? Infections that are passed from one person to another, okay? Because of physical contact, right? Any other answers? Okay, great. So those were very close answers and almost the correct ones. STIs are not only infections that are passed from one person to another because uh, they're more of what are transmitted due to sexual activity. Now, when I say that this is an infection caused due to engaging in sexual activity, what all exactly comes under sexual activity, right? So sexual activity can look like vaginal sex, oral sex, anal sex, or even skin to skin contact, or things like kissing. So kissing also something, sometimes people do not realize that kissing comes under sexual activity, but that is also something which comes under sexual activity and can lead to sexually transmitted infections. Okay, so how are STIs transmitted? So there are several things that can take place for a transmission of STIs to occur. Contact between penis, vulva, vagina, rectum. So rectum in case of anal sex. Breaks in skin. So if you are having skin to skin contact with someone, and if there are breaks in your skin, an STI can be transmitted. Mucous membrane. So for example, oral sex and kissing, just like I mentioned, and sharing needles. So what do I mean exactly when I say sharing needles? Sometimes when there are per se blood camps, where we go and donate blood, there are chances that they're not using a fresh needle every time they are trying to take out blood from a person. Now, in that case, if there is a person or an individual who has come over there in that blood camp to donate blood and has an STI, if a fresh needle is not being used and if that needle is being used on that person or on that infected person and then being used to a person who was not infected earlier, chances are that the person who's going to share that needle is also now going to have that STI. Or in cases of getting a piercing done or getting tattoos done, that is also where sharing of needles should be avoided as it can lead to transmission of STI. Blood contacts, similar to what I just explained, and STIs can also be transmitted vertically from mother to child, that is during pregnancy or breastfeeding. Okay, there are few high risk factors, which means that there are chances that because of all of these, the probability of you having an STI increases. The first one being having unprotected sex or incorrect usage of condoms or tampons. Now, unprotected sex, as mentioned before, any sort of sexual activity that is not being, if being not being used a condom and doing it without it, chances are that you have the high risk of getting an STI. Okay, a show of hands of people who know what are dental dams. I'd like to see. All right. So yeah, what I'll still like to explain what dental dams are. So dental dams are used in cases of usually oral sex, and it's made up of it's a very thin sheet that is made up of latex, and sometimes there are also dental dams available that are made out of material other than that of latex. It provides a barrier, a physical barrier between the mouth or other parts that come in contact with, per se, with the vagina or the anus. And if that is not being used correctly, it increases the chances of an STI. So if that thin sheet is being used on both ends. So for example, this is the sheet, here is your mouth, and here is per se the vagina. The next time you're probably engaging in oral sex, the mouth is over here and the vagina is over here. Now, in that scenario, the mouth is being in contact with the residue or the specimen that has been left by the vagina on this side of the sheet. Now, or on this side of the dental dam. Now, when that happens, that increases the risk of STI because the purpose of the dental dam just got defeated, right? So having unprotected sex or incorrect usage of condoms or dental dams increases the risk of STIs. Having sexual contact with multiple partners. Now, it's not something which is scientific, but it is instead something which is just maths, right? So if you increase the number of partners, the probability of you having an STI just naturally increases because of more number of partners, right? Having a history of STI. So just like I mentioned in the myth versus fact activity before this, if you have had, if you have been, detected for an STI previously or in the past, chances are that that STI can come back into your body again. So having a history of STIs increases the risk of you having an STI in the future. If anyone has been forced to have sexual intercourse or sexual activity, misuse of alcohol or use of drugs. Now, sometimes people get confused as to how this increases the risk factor in STI transmission. It basically it means that if alcohol is being consumed a lot, or if drugs are being inserted using injections and there is sharing of needles that is happening, the risk of STIs increases because it decreases your immune system. So if so the probability of you catching an infection increases because the strength of your immune system goes down because of excessive alcohol or drug usage. Okay. Coming on to the next topic of what are common symptoms that you can detect on your body if in case you have an STI. Sores or bumps on the genitals or in the oral or rectal area. So in your private body parts or around your body, you would feel sores or bumps. Painful or burning urination. When you are going to urinate or going to pee, you will feel pain or burning sensation. Discharge from the penis. Unusual or odd smelling vaginal discharge. So if you feel that your vaginal discharge is not is not transparent or sticky and is starting to smell or is having a fishy type of odor, that is a symptom that you should look out for. Unusual vaginal bleeding, pain during sex, sore, swollen lymph nodes, particularly in the groin area, lower abdominal pain, fever, rash over the trunk, hands or feet. And the last symptom is that you probably would have no symptoms at all. This is something which everyone should pay attention to, because research says, and this is what we've observed as well, that there are several STIs out there which are not going to show any sort of symptom in your body. So what exactly can you do if you want to check whether you have an STI or not? And that is something that now we want to discuss. You will have to get tested for an STI to get to understand or get to know for sure, 100% for sure, whether you have an STI or not. There are chances that you probably would not have any symptoms, and that is exactly why you should go ahead and get yourself checked for an STI if you are indulging in sexual activity. Now, how exactly to get tested? Should talk to your doctor about sexual history, including whether you had unprotected sex. Any symptoms, so all the symptoms that I mentioned previously, if you had any of those symptoms, you should discuss it with the doctor. If a partner was recently diagnosed, so if there is a partner or a person who you were in contact with physically or sexually, in that case also, you should talk to your doctor about it. Based on this, a doctor may recommend an STI panel, which is a testing for multiple STIs or for specific tests. Now, what all doctors should or would mention when you go for this test? So, this is a key thing to remember. So, if you are a doctor, you can probably keep the 5 P's in mind if someone comes up to you to ask for, whether I have an STI or not. The first P refers to partners. So, this refers to how many partners you have. What is, what is the gender of the partner that you are being sexually in contact with. Now, in this, something which is very important is that you should not assume someone's the number of partners that a person may have. You should also not assume the gender uh, to which that partner may belong. Now, why is it that getting to know the gender of the person is important is something that we'll discuss in further slides. Because for a few genders, the risk of getting an STI is more as compared to others. And another thing to note over here is that if a person talks to you about the number of partners or the gender of the partners, one should always maintain that as confidential information, as of course, I'm sure all of you as doctors would be doing. But to also not give them an idea that it's a bad thing that they've come here. So an open environment is something which is very important if a patient comes to you for this. Practices mean so they help understand. So if there are people who are engaging in oral sex or anal sex or vaginal sex, so if we talk to them about what are the usual practices you follow when indulging in sexual activity, it helps us understand the sites from which we can take a sample or a specimen when we are going to run further tests. Protection from STIs. So you should talk to them about all the things that you should do to prevent STIs. Again, something which we'll discuss in further slides. Past history of STIs. Now, I've talked about this twice in this meeting as to why asking them about the history of STIs is important, so that you know as to whether a mother to child transmission or transmission previously has occurred in the individual or not. Pregnancy intention. Again, something which is to be noted, because if per se a person wishes to get pregnant in the future and they do contact an STI, it's very important for us to tell them that if you do get a baby, the transmission from mother to child can occur after the pregnancy or during the pregnancy. Okay. Moving on to what does an STI test look like? So when you go to the doctor suggests that, okay, you should get a STI test done. Depending on which STI you are being tested for, the testing can include the blood test. For example, if the doctor feels that you might have an HIV, a blood test is recommended. Urine test in cases of chlamydia, vaginal, cervical, urethral, or rectal swab in cases of, say, gonorrhea, and physical exam, for example, in cases of herpes or warts. Now, to conclude, the tests can be either a blood test or a urine test or a vaginal, cervical, urethral, or rectal swab, and then testing of the swab or a physical examination. Now, these are just examples of probable STIs that we've given in the slide. Does not mean that if your doctor is recommending you a blood test, you have an HIV. So do not worry about that at all. This is just this is an example that we've used. A general STI panel will usually include using all the methods that we mentioned over here. With that, moving on to something that we all should spread awareness about, that is how exactly to prevent STIs. Use condoms and dental dams because they are the only ones that provide or reduce the risk of STI transmission. Consider abstinence and avoiding sexually risky behavior. Abstinence means that avoiding getting in sexual contact or skin to skin contact with individuals other than you. Just give me a second. Yes, and avoiding sexually risky behavior. So avoiding things like indulging in sexual activity without the use of condoms. So that is sort of a risky behavior. Don't share needles, and for this, I've explained to you the reason as well. Talk to your partner about their status or sexual history. Get tested regularly, that is once a year if you are sexually active. You should also get tested before engaging in sexual activity with the new partner, and you should also ask the partner that you're indulging in for communication as to whether they've previously had an STI. Get vaccinations early, for example, for HPV, hepatitis A, and hepatitis B. These are the 3 vaccinations against STIs that are available. They are antibacterial vaccinations, and you can get those vaccinations as early as 10 or 11, and even in some cases, they allow getting vaccinated at the age of as early as 9 years old. So one should spread awareness about those vaccinations around us. Preventive methods like the PrEP medicine, which is the HIV prevention for high risk groups. So what this medicine, this is a sort of medicine that helps decrease the spread of HIV as an STI. Now, there are 2 forms in which this is available. One is from oral pills that you can consume this medicine or this preventive method, and the other one is using injectables. Now, the oral pills are to be consumed on a daily basis, and so the first time you have a pill, after that you should wait for about 7 to 10 days before indulging in sexual activity. Whereas in cases of the injectables of of the PRP medicine, you can wait for a period of 2 months for getting that injection done once again. So this is something that you need to note, however, that if you do not consume the oral pills regularly, or if you miss a day, or if you do not go ahead and get that injection done after a period of 2 months, chances are that the medicine is stopped going to work or is not going to work very effectively. Mutual monogamy. So that's another method how you can prevent STIs. Monogamy means getting indulged in sexual activity with just one individual. Something to note over here again is that before deciding a partner as to with whom you want to practice mutual monogamy, you should get them as well as yourself tested, so that it's not that both of them or one of the individuals have STI already and they're practicing mutual monogamy, that is indulging with just each other, because in that case as well, STI can of course get transmitted. Education and information. So just like we're having a session over here, we are trying to spread awareness about STIs. If you go ahead and do attend the session or watch the session, you should ensure that you spread this information across around yourself and around the people around you as well. Destigmatization. Now, there is a lot of stigma around STIs or STDs, that it is something which is looked down upon as a society. And because of it, if someone even experiences symptoms of STIs, chances are that they will be scared to go ahead and get that test done. Which means that if they are not going to get that test done, they cannot ever get the preventive methods or the medicine for the same, or the precaution for the same, or the treatment for the same. And if that does not happen, they will continue to live with that STI for the rest of their life. And that can be prevented or eradicated by us as a society if we start to destigmatize STI as a topic. Okay, moving forward with the next topic. But wait, before I move forward, it's been a while and I would like to ask the audience if there are any questions as of now. There's a text that I can see, kissing can give STI. Yes, kissing can transmit STI, and that's why people opt for dental dams even for things like kissing. All right, it's 4:40 right now. I'm going to wait for 4:41 in case someone is typing their question in the chat box. Okay, great. I see no questions as of now. But if you feel that in the entire session you want to ask me a question, you can either raise your hand, and honestly, I cannot see if someone is raising their hand. So try and unmute yourself. Or what you can do is type something in the chat box, or even type something like stop or I have a question in the chat box, and I'll go ahead and look at what you are typing and stop the session for a second. So yeah, feel free to ask any questions that you have in the chat box or by unmuting yourself. All right, with that, moving on to something that I want to point out, that or something that I'd like to ask you as an audience, that homosexual and bisexual men or other men who have sex with men are disproportionately impacted by syphilis, HIV, and other sexually transmitted diseases. Does anyone in the meeting know as to why that is the case? There are no right or wrong answers. If you even have the slightest of idea or think or are thinking in a particular direction, just feel free to type it in the chat box. Okay, so there's nothing innate about men or men who have sex with men. The reason behind why the probability of them contacting an STI is high is because unprotected anal intercourse for both men and women increases the likelihood of contracting an STI because of the rigidity and fragility of the rectal tissue. This makes anal tissue more susceptible of tearing. So when it gets teared or there is a break in the skin or break in the area, it increases the risk of becoming infected because the transmission of STI goes directly inside our body, which increases the risk. Okay, moving on to a few common STDs that we probably might have heard about. Now, do not consider the cross, as this is not the correct answer for this. Consider the cross as a tick mark. The STD, for example, chlamydia, is bacterial in nature. It can be cured, and transmission usually happens from fluids, so from bodily fluids. Gonorrhea again is a bacterial. Syphilis again is bacterial. Both of them can be cured. Gonorrhea, the transmission of gonorrhea happens from fluids, and of syphilis from skin to skin contact. And then there are other few, 2 to 3 mentioned that you can go ahead and have a look at. You will observe that usually the ones that are viral, so that are viruses, are the ones that cannot be cured. And although HSV and HPV both can be treated, which means that the treatment exists, but it cannot be removed from the body permanently. So temporary relief to an individual is possible from treatment and from medication. However, a 100% solution to this still does not exist in the society. Okay. Talking a little bit in detail about gonorrhea and chlamydia and other STIs. They are bacterial infections that can affect the reproductive organs, often with no symptoms but possible complications. So symptoms can include more or less the ones that we've discussed, and both infections are treatable with antibiotics, and follow-up testing is absolutely advised. Okay, HPV. So HPV is a viral infection that can cause genital warts and increase cancer risk. And again, a few key points to note over here are that most HPV infections have no symptoms, just like any other STI may not have a symptom at all. Some types of HPV can cause genital warts. There is no specific antiviral treatment for HPV, just like I discussed. Treatment focuses on managing symptoms and preventing complications. Genital warts can be treated with topical medication, freezing, or surgical removal. HPV vaccines are available to prevent certain infections and related cancers. Again, something that you can take as early as 10 years of age. Syphilis. Now, it's caused by this bacteria, which progresses through stages with distinct symptoms and can lead to severe health problems if it's untreated. So, again, another reason why destigmatization about STIs is important, because if people do not realize that it is something which requires immediate attention, it can lead to severe health problems. Its symptoms vary by stage to stage. So in the early stage or in the primary stage, it's painless sore at the injection site. Secondary stage looks like rash on the palms and soles, flat warts on the vulva region. So vulva is the region which is present between the legs of the female, or around or in the region from where the vaginal opening is present, and flu-like symptoms. Okay. Latent infection looks like no symptoms at all, but the infection is still present. Syphilis is again treated with antibiotics because, like I mentioned, it's a bacterial infection. And typically, the antibiotic used is penicillin. Genital herpes. It's caused by the herpes simplex virus, which is the HSV, and may result in painful sores in the genital or oral area with the potential for reoccurrences. There is no cure for genital herpes, but the infection can be managed. Since it's viral in nature, or it's spread due to a virus, that is why there is currently no cure for the infection. Antiviral medications such as acyclovir or valacyclovir can shorten the duration and severity of outbreaks. Daily antiviral medication suppressive therapy can reduce the frequency of outbreaks and the risk of transmission to partners. HIV. So HIV is a virus that attacks the immune system, leading to acquired immunodeficiency syndrome if untreated. It is managed with antiretroviral therapy. And a point to note about HIV is that usually cases in India suggest that there are people who try to infect other people with HIV just because it is said that it is going to attack the immune system in such a manner that it can never be treated and they will have the infection for the rest of their lives. Which is why people who do get infected sometimes try to spread across the infection because they feel like if I am having this for the rest of my life, probably others should have it as well. And that is something that as society you should also look out for. That if someone is trying to, out of the blue, pinch you a needle, or sometimes I've heard cases where if you parked your scooty in an area, there are chances that if a person around there wants to spread across the infection, they sometimes put an infected needle, a very small one, something that you will never notice. And as soon as you sit on the scooty, that infected needle will pierce in your skin and the infection will then get transmitted, right? So for people who out there, usually travel via scooty, this is something that you can look out for. There is no cure for HIV, but it can be effectively managed with antiretroviral therapy. The medications help control the virus and maintain a healthy immune system. Early treatment is crucial for long-term health and reducing the risk of transmission. Regular medical monitoring and adherence to medication regimens are essential. Okay. Other STIs, so we've mentioned a few, and they're caused by a microscopic parasite, while hepatitis B and C are viral infections affecting the liver. Again, a few other STIs that you should look out for, and for which preventive measures do exist. And if awareness and education about this spread across in the society as a whole can benefit from it by destigmatizing the topic and by getting timely treatment. Okay, difference between RTI and STI. So RTI are reproductive tract infection, whereas STIs are sexually transmitted infections. And sometimes people get confused between the two. So like I mentioned, the first difference, of course, is their full form. The three main reasons for an RTI can be increase in the normal count of bacteria found in the reproductive tract, other bacteria finding their way into the reproductive tract, and lack of hygiene. Whereas in cases of STIs, like we mentioned previously, unprotected sex, infected blood, or genitalia and throat and anal secretions can cause STIs, and all the other things that we talked about in the slides before. Another difference between the two is that though reproductive tract infections can happen to anyone, female-bodied persons are more susceptible to them, as it is easier for external bacteria to enter the female reproductive tract. In cases of STI, chlamydia, gonorrhea, hepatitis B, hepatitis C, herpes simplex, syphilis, and HIV, that goes on to become AIDS, are the most common STIs. STIs and RTIs have some common symptoms. So, burning sensation, itching, pain, boils or pimples, unusual secretions, foul odor, swelling, pain while having sex, frequent urination, changes in the menstrual cycle, etc. So, just like I mentioned that, there are several symptoms for STIs. Those symptoms are common to RTIs as well, right? And there are few symptoms that can probably be of something else that is going on in your body. That's why, and of course, there are sometimes no symptoms at all for STIs. That is why it's very important that instead of just looking out in your body for those signals or signs, uh, for your body to in your body to show up for an STI, it's instead better that you go ahead and get an STI test done. STI stigma. Now, something again that is very important, that we need to tackle the infection or the disease and not the person. Individuals with STIs often face judgment, shame, and social isolation, which makes it very common for them to not go ahead and get treated at all. And something that we've now realized in this entire session, that if it does not get treated, it can lead to severe health conditions, which is something that we would not want for anyone around us or anyone in society. And that is why something that we need to look out for is to decrease the stigma around STI. Normalize talking to your partner about STIs. Normalize getting tested. Social support for individuals with STI. So if you do come across a person or someone who you know to be in contact of an STI, how is it that you can support them? Ensure that you are talking to them openly and communicating with them openly about that yes, the stigma in the society exists and the stigma might be impacting you to some or the other extent, and how it's important for them to understand that even if the society might not look at them with a straight face or might not look at them as if it's a normal infection, you as an individual will do that, and you understand that getting treated for an STI is something which is more important than judging the person as to why do they have an STI, because anyone across us can have an STI because of several reasons that we have discussed in the session. Healthcare's role. So it's very important that if someone enters a healthcare area or a clinic and they want to get tested, a, a comfortable environment for them is very, very important so that they can actually go ahead and get themselves treated. Otherwise, if someone feels that they are being judged, they would definitely would not want to come back to that area, right? Combating misinformation. So any other thing which comes across as to you as rumors or myths, probably a few of them that we've discussed in the very beginning of the session with the activity, try to combat them that this is not true and this is actually the factually correct information, and present them to the person without feeling any sort of hesitation. Empathy in practice. Ensure that there's a judgment free zone whenever you are you know talking to people about STIs, and include that in your day-to-day practice and in your healthcare practices as well. All right, so with that, we come to the end of the session, and a few key takeaways for the session would look like that STIs spread through intercourse, bodily fluids, and unsafe practices. Some STIs are asymptomatic, that is, they might not have any symptoms at all. Unprotected sex, multiple partners, and drug use are high risk factors. Testing includes blood, urine, and swabs. Regular screening is essential, that is, once in every 6 months or in every year, or if you're getting in contact with a new person and engaging with them in sexual activities. Gonorrhea, chlamydia, and syphilis are treatable. HPV, herpes, and HIV are manageable since they are spread across from viruses. Use condoms, get vaccinated, and communicate with partners to prevent STIs. Another thing that you can also use is gentle dams for oral sex and kissing, and of course for anal sex. Reducing stigma through education and open conversations is very, very crucial. With that, we come to the end of this session, and it's an official wrap. I would like for the audience to ask questions if there are any. There's also a QR code that you can see on your screen, which is for the sex ed course. Pratisandhi Foundation covers all sort of key thematic areas in this course, and if you feel like uh, if you want to know more than just STIs and have uh, and want a certification in being for being a sexuality educator, or just for being a more aware person as an individual, then of course you can go ahead and scan the QR code that is present on your screen right now. All right. Thank you everyone so much for joining and for being a part of this session. And if there are questions, I'm going to return to the main screen, and we can have those answered.
Okay, thank you so much, Anisha, for the great, informative, and simply, and it is elaborative for various STIs you have explained, and which is understandable by all age groups. And I have a simple question, like every time I approach any schools, colleges, few schools, colleges, they are very much like they feel like it's a taboo subject, and they try to prevent this type of discussion. They ask us take a prior some health topic, and just in case they are comfortable, then go with it. So, what are the scenarios you have faced in your organization in Delhi or any other places, like to organize a simply sexual health education programs?
Right. So not just about STIs, I think people also feel uncomfortable if topics like gender and sexuality are being presented. Or even sometimes, if it's a co-ed school, they'll be like, let's separate girls and boys and then have a menstruation session. And all of that is very common. The approach that we follow is that we ask them as to would they want their students to be more aware individuals or not, and as to how school forms or organizations like colleges form the basis of the future of the child. And if they go ahead and try to search the internet about all of this, there's a lot of misinformation out there. So if, for example, there's a student, right, and they want to explore about their sexuality or about anything at all, they're probably going to go to Google and search it up, and it's going to be filled with rumors or content that is not appropriate for their age, which is something that we lead with when we are communicating with organizations or schools, that to prevent that from happening and to prevent misinformation from happening, this is why you should go ahead and have this session with them. And of course, if there is a backlash as to why these topics are being discussed, then we go ahead and deal with it with the audience itself instead of dealing it with the organization. Because we need to understand that if the people from, per se, the organization that we go ahead and start talking to their children about it, the children are going to feel uncomfortable. The audience might get uncomfortable that this is a topic that I usually would not want to discuss with someone who per se teaches me every day, or who per se I deal with every day. But especially this happens in Pratisandhi Foundation, and something that we use as a trick to approach organizations is that we are an outsider organization, and when we're going to deal with the students, they will feel more comfortable in discussing it with us because they know that there is nothing to be worried about. So I think that is another approach that you can follow as well.
Really, it's a point that we can tell the pros and cons. Mostly, we need to make understand them what could be the better vision we can do, and better thinking power we can develop in youngsters, so that they can be preventing themselves from these all things. So, how is the approach from your side for organizing such? What all things you will plan up to promote sexual health education among school and colleges? What all steps you're taking?
So, okay, so usually we have drives. So, for example, for things like family planning drives or menstruation, we have drives wherein we spread across uh, awareness, as well as we sometimes also distribute menstrual pads or contraceptives so that everyone is more aware, and everyone is also has the access or awareness about how these things are present. We usually have a lot of sessions with communities. So per se, there are semi-urban communities that we go to, and they have a fear of using contraceptives because they feel there might be some negative effects of it, or if they want to get a treatment done, a permanent treatment done, they'll be not very sure about it. Or if there is a new contraceptive that they want to try, they'll be like, I've heard about this, I've heard about that. So all of those things we discuss about. Then there are also sessions that we take with schools, with teachers, with parents. We discuss several different topics relating to STIs, menstruation, body image, gender and sexuality, puberty, and yeah, so everything that comes under, honestly, comprehensive sexuality education. And sometimes we either receive a request for that, or if there is a community drive that we are running, then we uh, spot out areas that probably might have the best audience, the best target audience for our program, and then we give them a call. We ask them if they want to have a session with us, and that is exactly how we move forward with it.
Okay, that's great. And I would want to means progress towards a vote of thanks. If you're okay with it, you want to tell anything?
No, I just want to ask the audience once if there are any questions from your end. If not, then absolutely we can move to the conclusion of the session.
Yeah, if any questions are there, they can surely post in the comments so that any of us can rule out their queries. So I would like first to thank, I actually want to mention this program is under Sexual Health and STI Committee, Fogsi, which is uh, presided by Dr. Apurva Kumar Datta. And I thank sir for giving me permission to carry on this program. Along with I thank Pratisandhi, Dr. Niyati Sharma, and I want to thank advisor Dr. Seema ma'am. And I would like to really thank your as a facilitator and also speaker for this session, who have just simplified to be understandable for the symptoms and preventive methods about STIs. And further, I would like to associate with Pratisandhi on the other side, which are taboo subjects, and I would like to discuss on this platform so that everybody get awareness about these taboo subjects. And I request audience, and I also thank audience who have joined now or joining further. And this video shall be really helpful. And also, if they have any queries, they can just post in the comments, and they can like and share the video. Surely, and you can just mention the topics or anything we can discuss further with along with Pratisandhi, and anything we can just mention in the comments so that we can just prepare a video or prepare the awareness session along with Pratisandhi. So thank you so much, and we have Madan Kamble sir with us. So you want to tell about this program? Anything from your side, Madan Kamble sir? He's the national coordinator for STI, Sexual Health and STI Committee. Madan Kamble, sir.
Hello.
Yes, sir.
Yes.
Thanks for joining, sir. Any of your comments, please?
No, it's a wonderful program you are doing, and congratulations for this nice initiative and the program. Yes, sir.
Thank you, sir.
Yeah. Continue, please. Thank
Thanks,
you.
everyone. So thank you, Anisha, for the wonderful coordination. So thank you.
Thank you so much, ma'am, for giving us this opportunity. I think we are honored and very grateful to you to be a part and be in collaboration with you as an organization. And absolutely looking forward for more such collaborations in the future.
Yeah, thank you.
Thank you.